Thanks for tuning in to Bella Within, a sacred space where feminine wellness meets the healing wisdom of your soul. I'm Anya Bella, a devoted guide and educator in feminine wellness, here to walk with you as you reconnect with your body, restore hormonal harmony, and return to the truth of who you are from the inside out. Hi, beautiful. Thanks for tuning in to today's episode, The PCOS Epidemic in Young Women Happening Worldwide. This is going to be a heavy, informative episode today. You'll be learning a lot of new information, hopefully. So whether you're learning for yourself or somebody else, make sure to grab a notebook and pen and be ready to jot some notes. First, we'll start by uncovering what PCOS is. Then we will discuss what kind of women are more susceptible to the condition, how it is diagnosed, and some symptoms. Lastly, we will reveal what treatments are available, holistic, and prescriptions. Now, I want to be vulnerable here for a brief moment. I was diagnosed with PCOS a year or 2 years ago. I have had to do a lot of learning on my own, and I felt like I had a lack of support from doctors. So this is why this episode today is so important to me, because I really want to make sure that those of you who are in a similar situation as I was about 2 years ago, with so many questions and concerns and feeling very alone, I want to kind of serve as a support for you. The support that I wish I had when the doctor told me that it looks like I have PCOS. Today's mantra is, balance and harmony flow through me gracefully. So what is PCOS really? PCOS stands for Polycystic Ovarian Syndrome. The name can be a little misleading because some women do not experience cysts on their ovaries, but PCOS is a hormonal imbalance condition that does affect your reproductive organs. I think there's a lot of uncertainty with this condition, so I wanted to start with a little debunking some myths that I've heard and I've looked online to see what people think PCOS is or what they're confused about. So I have a few myths I'm going to read out to you guys. Many think PCOS is an infertility issue only. This is not true. It is a hormonal condition that can at times contribute to infertility. A lot of women with PCOS are able to have children and bear a pregnancy. So please don't be worried that if you got diagnosed with PCOS that you are automatically going to have infertility issues. That is not true for all patients with PCOS. Next, this ties into the first one, PCOS causes infertility. Again, not true. I already explained many women diagnosed with PCOS are able to conceive and have healthy babies. Birth control pills cure PCOS. Although a lot of primary care providers recommend patients with PCOS to be on a hormonal birth control pill, it is not curing the condition. It only helps alleviate symptoms. Women with PCOS are overweight. Not true. There are some women who are overweight with PCOS, but PCOS is very diverse. There are skinny women with PCOS. There are bigger women with PCOS. If I have PCOS, I will also be diabetic. This is a great one. So not all women with PCOS have type 2 diabetes, although many have insulin resistance issues. This does not mean a PCOS diagnosis qualifies you to be diabetic, though. The prevalence of type 2 diabetes in non-PCOS women is 1 to 3%, where women with PCOS is 12.4% of them have type 2 diabetes. Hopefully that cleared up any misleading claims you have heard about the PCOS condition, and let's move on to what PCOS actually is. A brief overview of some of our functions of our ovaries. So, our ovaries are responsible for producing androgens, also known as our sex hormones. I don't want to get too technical with names, but a familiar androgen you may have heard of is testosterone. Testosterone, along with other hormones, make up your androgens. Sometimes women will have visible signs that indicate they do have high amounts of androgens. They can present themselves as excessive facial and body hair on women, male pattern baldness, and acne, especially those cystic hormonal acne breakouts. These symptoms, in addition to more, will be discussed later in this episode once we explore diagnosis and the symptoms portion. Again, some women with PCOS sometimes have insulin resistance, making it harder to regulate their blood sugar, leading to type 2 diabetes. Most primary care providers will test for type 2 diabetes because PCOS is a risk factor, but as explained in the myths debunking, not all women with PCOS have type 2 diabetes. I'm sure as you are already starting to understand, PCOS is not a one-size-fits-all condition. Some women do not have high amounts of androgens, cyst, insulin resistance, or some women just have all. While the exact cause of PCOS remains unknown, researchers do know that there are several contributing factors like high levels of androgens, insulin resistance, and a low-grade inflammation in the body, which can lead to PCOS. Let's dive into the demographics. Who is PCOS targeting the most? So PCOS rates are pretty similar across most races and ethnicities, but studies show that Hispanic women seem to be hit harder. They're actually about twice as likely to be diagnosed compared to other groups. Although race isn't a major determinant, age is. PCOS heavily affects reproductive aged women. The World Health Organization states reproductive aged women are women anywhere from 15 to 49 years old. In the US, there are approximately 5 to 6 million women with PCOS. Worldwide, this looks like approximately 6 to 13% of all women are living with PCOS. There is also a geographical component to PCOS. Geographically, high rates of PCOS are found in North America, Europe, and Australia. Lower rates are found in East Asia. Research does prove that this condition is largely genetic. Approximately up to 72% of the condition is genetic. This means, unfortunately, being diagnosed with PCOS is often out of our control. If you have access to your family history, look to see if PCOS runs in your family. That could be a great indicator on whether or not you will be diagnosed with PCOS in the future. Make sure you talk to a healthcare provider about your risk for PCOS. 1/4 of all women with PCOS have a mother who also has it. As a reminder, this number is often underreported because there are large rates of women living with PCOS who are undiagnosed. What is that true percentage of women worldwide living with PCOS undiagnosed? According to the World Health Organization, that percentage is up to 70% of women right now. Now let's say you yourself are walking into a doctor's office with some concerns because you feel like you may have PCOS. What steps will the doctor take to diagnose you? Well, the doctor will start off by asking a series of questions. They may run tests to see if you fit the criteria to be diagnosed. This is known as the Rotterdam criteria. Now, in order to qualify, you will need to meet a minimum of 2 out of 3 specific features. These features are oligoanovulation, hyperandrogenism, and cyst on ovaries through an ultrasound. It's usually multiple cysts, so sometimes they'll say polycystic ovaries, which is the name polycystic ovarian syndrome. Oligonovulation. Ovulation is in its name. This is just a fancy way of saying you are not ovulating regularly, which means you may be having irregular menstrual cycles. A doctor will ask how far apart your cycles are and if you ever completely skip cycles. And depending on your answer, you will either be marked yes or no. Next, hyperandrogenism. As we learned from earlier, androgens are the male sex hormones. This is when you have too many androgens, hence the word hyper. A doctor will diagnose this through a blood sample or through visible indicators like acne and excessive hair growth. Lastly, polycystic ovaries on an ultrasound. So this one will require medical imaging to be done. A transvaginal ultrasound is typically done to examine your ovaries, looking for 12 or more follicles measured 2 to 9 millimeters, and also analyzing the overall size of your ovaries. So yes, it is possible that if you have irregular periods and acne, that's all it takes to be diagnosed with PCOS without even having the ultrasound done. But please, always advocate for your health. If your doctor does not discuss an ultrasound, but you would like one, you have the right to ask for it. Now that we know how we are diagnosed with PCOS, we can explore some symptoms. And some of these I have already mentioned, so I will not go too far in depth. First one, this is important. No symptoms at all. It's crazy. So many women are living with PCOS and don't know they have it because they actually don't experience any of these symptoms. Next, irregular periods, acne, obesity, abnormal hair growth, cyst, thinning hair, darkening of skin around armpits and between legs, under breasts, skin tags, and infertility due to not ovulating. Most women are not diagnosed until their late 20s and 30s. This is likely because they are struggling to conceive, and this is when the doctor will inform her that she may have PCOS, and this is why they are struggling. How is PCOS treated? PCOS is considered a chronic condition. This means once you have it for life. But through lifestyle changes and individual awareness, many women manage their symptoms and live very healthy lives. Treatments vary based on whether or not you are trying to get pregnant, what your symptoms are. As mentioned previously, these treatments are only assisting in managing symptoms, and they are not actually curing the condition. Some treatments that are used currently through healthcare providers are birth control pills, ones that contain both estrogen and progestin to assist in regulating your estrogen levels. Also, progestin therapy. This helps regulate periods for women. Spironolactone, which helps reduce androgen production, like women who have really bad cystic acne or excessive hair growth. Pregnant women, though, you should stay away from this medication because it can cause birth defects. So birth control is actually required if you would like to take spironolactone. Metformin. So this helps women with type 2 diabetes improve their insulin resistance. Clomifene and letrozole are for women who are wishing to become pregnant. It helps them regulate their ovulation and make sure that it is consistently occurring. Now, holistic treatments. I'm big on holistic treatments because, like I mentioned before, these prescription medications it's a temporary fix, a temporary band-aid, and we're not actually curing or fixing the true cause of what PCOS is. Maintaining a healthy weight for you. This is important for women with PCOS because this can help reduce insulin and lower androgen levels, which helps us regulate our menstrual cycles, which is important. Exercising regularly, improve mood and stress levels, and it also helps manage our insulin levels. Managing stress. This is because chronic stress can worsen symptoms. Last episode, I discussed our stress hormone cortisol. I also gave 7 tips on how to reduce high cortisol levels within the body. So if you want to know how to reduce stress levels and how bad high cortisol can be for you, make sure you check out my last episode. Next, I don't like saying diet, as my mom always told me to never go on a diet because it has the word die in it. But monitoring what you are putting into your body is so important. The more whole foods, fruits, and vegetables, the better. Try cutting out those ultra-processed foods because it's just not good for you, and it's especially not good for you if you have PCOS. Try drinking spearmint tea. Some research shows it helps reduce testosterone levels and excessive hair growth. Also try adding cinnamon to foods and drinks. It may assist in insulin sensitivity and regulate menstrual cycles. I love adding cinnamon to my oatmeal and coffee in the morning. Berberine is an herb used in ancient Chinese medicine. This is something that if you're interested in that, you can definitely check it out. And some women find that inositol supplements help them. This is a B vitamin, which can assist in insulin sensitivity and restoring ovulation. One important thing to note with holistic remedies, as much as I do love them, there is typically less research and studies done to show the effectiveness. That does not mean that holistic treatments don't work. I'm passionate about this, but I always recommend to try to mix holistic treatments with Western prescription drugs, just because usually holistic treatments don't do harm to us, even if they aren't as effective. Feel free to consult with your healthcare provider on the holistic treatments that you are thinking about using. Thanks for listening to this episode of Bella Within. I appreciate each and every one of you. This was an important topic today because so many women around the world are diagnosed with PCOS, including myself. I hope now you have learned more about this condition, and if you yourself have it, hopefully you do not feel alone and you feel encouraged to advocate for yourself when it comes to your health. A PCOS diagnosis does not mean life is over for you. It just means you need to give your body a lot of patience and extra love. As always, remain Bella Within.